and general body weakness. However, upon medical evaluation, a diagnosis of high blood pressure or hypertension was made. Many Nigerian young adults are pursuing their daily activities without knowing that they have this condition. However, hypertension is known as a silent killer because it may be present in the absence of symptoms. It is not unusual for the disease to be discovered for the first time during routine medical examination for employment or life insurance or in the post-mortem room following sudden death. Unless the disease is diagnosed early and adequately treated, serious complications such as stroke, blindness, heart failure, and kidney failure may ensue. We now have enormous data on the prevalence of hypertension in Nigeria and worldwide, following some expert on Committee on Non-Communicable Disease under the WHO and the Center for Disease Control and Prevention. However, according to prevalence, 1 in 3 Nigerian adults have hypertension. About 1.38 billion adults aged 30 to 79 years worldwide have hypertension. Most two-thirds living in low and middle income countries. Hypertension is at high risk of those people who are living in low and middle income countries. Like I say, 1 in 3 adults have hypertension. Hypertension is more vulnerable and more at risk. Most of the people who are pursuing their daily activities are unaware that they have this condition. Less than half of adults, 45%, have been diagnosed and treated. More than half of adults, 55% of people are unaware that they have this condition. One of the global targets for non-communicable disease is to reduce the prevalence of hypertension by 33% in the year 2030. To understand what hypertension is, it is highly desirable to appreciate how the heart functions. The heart is a hollow muscular organ about the size of a closed fist. It lies in the chest between the lungs and above the diaphragm. The heart is essentially a pump, and the 2 compartments that constitutes the heart act as 2 pumps. It is the pumping action of the heart that ensures the flow of blood in the blood vessels to all parts of the body. Blood, of course, is the body's transport system, and its main function is to carry oxygen and nutrients to the tissues of the body and to remove waste from the tissues. The blood also helps in the maintenance of the body's temperature. The blood coming from the heart flows in blood vessels called arteries, either to the lungs or to the rest of the body, and these arteries form branches which again subdivide into smaller and tiny branches called arterioles and capillaries. In the tissues, the pump in the right compartment moves blood to the lungs, where waste gases such as carbon dioxide are removed and oxygen taken. The new blood containing oxygen or oxygenated blood is then returned to the pump in the left compartment, which then distributes this fresh blood to the rest of the body. The blood returns to the heart in another blood vessel called veins. It will now be seen that as a result of the pumping action of the blood by the heart, the blood will be under pressure. When a physician determines the blood pressure with a familiar blood pressure curve, 2 numbers are recorded. The higher of the 2 is the pressure expressed in millimeters of mercury developed in the major arteries, usually the artery in the arm or brachial artery, by the contraction of the heart, and is called the systolic blood pressure. This is also the pressure needed to just stop the blood flow in this artery. The lower number represents the pressure persisting in these vessels while the heart relaxes and refills between beats. It is called diastolic pressure. This is also the pressure that will just allow the pulse to be felt again. In all human beings, blood pressure varies from day to day and from minute to minute. It goes up when we are excited and goes down when we are at rest or asleep. These changes are perfectly normal. However, when blood pressure goes higher than it should and stays that way, it may cause some serious trouble. High blood pressure is a manifestation of an abnormal state of the circulation of blood or of diseases of certain organs. It is diagnosed when repeated examination of blood pressure is found to be above that generally considered normal of people of similar racial and environmental background. Here in Nigeria, a blood pressure reading of 150/90 mm of mercury in an adult is viewed with suspicion. In a large majority of patients presenting with high blood pressure, no cause can be found. This type of high blood pressure is known as essential hypertension. Some experts even claim that in over 80 out of 100 cases, no cause can be found. However, certain diseases are known to produce high blood pressure, and there are also factors that predispose to the condition. Of all diseases that are known to cause high blood pressure, kidney diseases are claimed pride of place. Some diseases of the kidneys producing hypertension may be successfully treated, while others prove resistant to therapy. Alright, diseases of the heart and blood vessels and diabetes are also known to play a great role in the generation of high blood pressure. Experts who have studied the disease report that hypertension often runs in families. People whose parents had hypertension are more likely to develop it than those whose parents did not. Other risk factors include obesity, smoking, stress, lack of exercise, and high level of cholesterol. But what are the symptoms of high blood pressure? Usually, it is symptomless disease, which is often spotted during routine general checkup. However, well-known symptoms by patients are headaches, palpitation, dizziness, disturbance of vision, shortness of breath, and weakness. High blood pressure, unless treated, gives rise to a lot of serious complications involving very important target organs. It will put enormous strain on the heart, leading to heart failure. It may affect the blood vessel in the eyes, leading to serious impairment of vision. It may affect the kidney to produce kidney failure, and it could affect the brain to produce disturbance in mental activity, convulsions, and stroke. We shall be considering briefly the involvement of these target organs later on. Alright, once a physician is fully satisfied that his patient has high blood pressure, he will proceed to carry out certain tests or investigation to determine the extent of damage already inflicted by the disease on certain target organs. The investigations are briefly described below with an instrument called the ophthalmoscope. The physician will look into the patient's eyes to assess the damage that the disease has done to the blood vessels in the retina. He will order a chest X-ray to see whether the patient's heart is enlarged. He may request for an ECG, that is an electrocardiogram, to see if there had been any previous damage to the heart. He will order blood and urine tests to see if there is any problem with the kidney. Following the completion of the investigation, the physician will then proceed to review the treatment option. If the cause of the high blood pressure is found, the treatment is directed towards removing the cause. However, in the majority of cases, no cause is found and treatment is directed at prolonging life and reducing complications. Patients who are fat are advised to lose weight, and a sensible weight reducing diet is prescribed. Those who smoke are advised to give it completely. The patients are also encouraged to reduce their alcohol consumption drastically. They are also urged not to add salt with their food and to give up sodium-rich food. The patients are also warned to avoid strenuous physical exertion, overwork, worry, and emotional stress. The doctor will then prescribe certain drugs or combination of drugs aimed directly at bringing down the blood pressure. The patient will be informed that the treatment may have to be for many years and urged to take his medication faithfully. The drugs used in the treatment are not cheap, and many patients in Nigeria find the cost unaffordable. These drugs are also not free from side effects, and all patients must ensure that they are fully familiar with this complication. Finally, to alleviate the suffering and premature mortality and morbidity of hypertension and its complications, the most effective methods lies in early detection, prompt medical intervention, and regular medical checkup that are found on a community-wide basis. Thank you so much for listening. I still remain, and I am, and I will forever be Igbenogugusha Elisha, your next entrepreneur. I love you all. Do have a lovely and wonderful day. Bye.